Vaccines do not cause autism. Let's just take a second to celebrate vaccines, because from a public health perspective, they're awesome. It's thanks to vaccines that humanity was able to eradicate smallpox, so far the only human disease we've managed to wipe off the face of the earth. Over the decades, vaccines have saved literally millions of people from suffering and even dying from diseases like polio, whooping cough and measles. But right from the start, vaccines had their skeptics. That's right, there have always been anti-vaxxers. It's just that they didn't have access to social media platforms to allow them to spread their bullshit far and wide. But let's come back to this specific idea about autism. That all sprang out of an infamous paper published in 1998, which was used to suggest that there could be a link between the MMR vaccine and bowel disease, as well as signs of autism. The paper has since been retracted, and lead author Andrew Wakefield has been struck off the medical register and roundly discredited. The paper was, to put it scientifically, a load of shit. It had loads of methodological flaws, a tiny sample size of just 12, and there were even allegations of data fraud and dodgy financial dealings. The great irony is that vaccines work so well, most parents today have never seen a case of measles. Society has largely forgotten just how serious these diseases can be. When there are so many loud voices planting the seed that the vaccines could harm your child, it's understandable that you'd be hesitant. For scientists wielding actual high-quality evidence, it can be hard to cut through all this noise. But it's vital that they keep trying, because fewer kids vaccinated means more outbreaks of preventable disease. These days, it's not just fringe social media blowhards they have to fight against either. The actual CDC, the foremost public health authority in the United States, quietly updated its website last year to state that the claim vaccines do not cause autism is not an evidence-based claim. But it simply is. Since the Wakefield paper, there have been dozens of rigorous peer-reviewed studies published examining whether rates of autism are higher in children immunised with the MMR versus those who never got the vaccine. Time and time again, they've found no evidence of a link. People have also looked closely at the ingredients in the vaccine. Some vaccines contain a preservative called thimerosal. One of its components is a form of ethyl mercury. Mercury sounds scary, right? Until you learn that ethyl mercury is not a risk to human health like other forms of mercury. It's broken down quickly in the body and doesn't build up and cause toxicity. But here's the kicker. It was also never present in the MMR vaccine to begin with. Another ingredient people have voiced concerns about is aluminium, present in compounds called adjuvants that help vaccines work more efficiently. Lots of studies suggest it is perfectly safe. And once again, it's not included in MMR vaccines anyway. In 2021, there was a Cochrane review of 138 studies. It found that both the MMR and the MMRV, an updated version that also protects against chickenpox, were safe, effective, and, say it louder for the people in the back, not linked to autism. Autistic children first tend to show signs that parents and caregivers notice around the age of 12 to 18 months. This is, coincidentally, the age at which the first dose of MMR is recommended. Autism is a developmental condition that scientists are still trying to figure out, but it likely has lots of interlinking genetic and environmental causes. Vaccines are not one of them.